Dear Mom and Dad, this film is our contribution. We hope you can listen up carefully and help all of you take a good care to the baby. Are you ready? Let's start to see what happened on this. Newborn screen. Newborn screen is a public exam designed to screen newborns shortly after birth for the set of metabolic problems. In our government, newborn screen must be done for each infant. Newborn screen tests are done by measuring congenital metabolic disorders. Total items of screen exam are about 11 rare enzyme deficiencies, including the following metabolic disease. The first one is congenital hypothyroidism, and then phenylketonuria (PKU). Next, homocystinuria (HCU), galactosemia (GAL), then glucose 6-phosphate dehydrogenase deficiency (G6PD), then congenital adrenal hyperplasia (CAH), then maple syrup urine disease (MSUD). Next, medium chain acyl-CoA dehydrogenase deficiency (MCAD), then glutaric acidemia type 1 (GAI), and then isovaleric acidemia (IVA). The last one is methylmalonic acidemia (MMA). The most common is glucose 6-phosphate dehydrogenase deficiency. This is so-called favorism. There is a high incidence in boys than girls. Therefore, when no screen reports come out, infants do not touch muscle, injection velvet liquid, or any antipyretic and analgesic medicine. It will be caused hemolytic anemia or any complications because of above problem. Please see the doctor immediately if infants suffer from fever or flu. Do not buy unknown medicine in the pharmacy. How to know the screen report? When surfing on the NTUH website, please enter mother's ID and check it out. After 2 weeks, you will see your baby report. This is website address. I will call out to the hospital, and this is telephone. How to know neonatal jaundice? Please watch 5 areas. The first one is face, then chest. The third one is thigh, and then shank. The last one is foot. And how to see your baby jaundice at home? It is the right time to observe jaundice in the daylight or white light. Do not observe in the yellow light or pink wall. And how to see what is jaundice? The method is you can press baby's skin gently about 2 seconds, and then start to press. It is normal sign when the skin gets a clear recovery color. And what is a normal sign? If your baby has jaundice, the recovery skin color will be yellow after stopping the pressing. When still yellow, please keep pressing until the next skin sign recovers to white. And what is the sequence of jaundice? Just pay attention to the more suffering sign is on the lower area. The sequence of jaundice is from face to foot, but subsiding direction is from the bottom to face. Hence, face is the last subsiding sequence. And jaundice is existed over 2 weeks. If the baby has a drowsiness intact, please take the baby to the hospital. Otherwise, there are stool cards in the baby's handbook. If baby's stool have the number 1 to number 6 color, please also take the doctor to the hospital.
把毛巾沾湿，用毛巾的两角擦拭眼睛，由内向外。毛巾的另外两角擦拭耳朵，毛巾外部再擦脸颊、额头、下巴及鼻翼。当宝宝洗头时，用手掌托住宝宝的头及颈部，左背夹稳宝宝于腋下，拇指及中指压住宝宝的两耳耳壳，然后再倒一些婴儿洗发精帮宝宝洗头。洗发精的量不用太多，也不要集中在同一个地方。 轻轻按摩着宝宝的头皮，再用清水清洗干净，用毛巾把头发擦干。如果宝宝的头上有硬块状的头皮垢，可以用婴儿油均匀的涂抹，24小时后再洗掉就可以了。用左手背扶住宝宝头颈部及肩部，左手紧紧抓住他的手背，让宝宝的头颈部可以完全的靠在妈妈的手背上。慢慢的把宝宝放入水中，用右手慢慢拨水在宝宝的身上，扶住宝宝头颈的左手背千万不要放松，这样宝宝才不会感到害怕。直接用已经溶在水中的沐浴巾轻轻地搓揉宝宝的身体、四肢。右手轻放于胸前，让宝宝自然靠在手背上，轻轻地将它翻过来。尤其是有皱褶的地方，妈妈可以一边帮宝宝洗澡，一边和宝宝说话，这样不但可以让宝宝感到安心，还可以增进亲子间的感情哦。全身洗干净之后，用浴巾把宝宝包起来，放在垫子上擦干他的身体，特别是皮肤的皱褶及腹股沟处。抹一点婴儿润肤乳液，滋润宝宝的肌肤。
Vaccine injection. After the baby enters into baby room, hepatitis B immunoglobulin will be prescribed within 24 hours. After birth, if puerperal has a positive hepatitis result, the first dose of hepatitis B vaccine will be injected when baby was delivered within 24 hours after pediatric doctor inspected and confirmed for a normality sign. And then BCG vaccine will be injected till normal screen reports. Mother can check the reports and they're injected in the clinic after 2 weeks. To apply for each vaccine, baby room will sign in every vaccine signature in the yellow card on your baby handbook. How to care baby's umbilical. Sterilize the umbilical cord pressed using 95% alcohol and cotton swab sterilized umbilical. And you can use this method about 4 times each day, so there will be after shower, after change diaper when umbilical contaminated. Otherwise, you can arrange sterilize the time by your lifestyle. And so use the alcohol swab and moistened with 95% on the 4 quadrants, including up, down, left, and the right. Do not sterilize umbilical after feeding or spilling milk, because avoiding baby crying is necessary. It will be adding choking opportunity. So this method, you need to turn up and rotate outward. Remember not to wipe back and forth. After each one used, each must smell what the flavor is and what the color is. And the method, and you can use this one. Turn down and rotate outward. Turn left and roll outward. Or turn right and roll outward. What is a normal sign? If it is redness or swelling around umbilical, please see a doctor. If a cotton swab reveals yellow secretion plus other persistent fever and bloody navel, please see the doctor immediately. How to care baby's temperature? Checking baby temperature is also necessary. When you are go home every day until 1 month, normal auxiliary temperature range is 36.6 to 37.4. It's not the right time for checking body temperature when just feeding, just crying, or just showering. Then over 37.5 degrees, please reduce the quilt or take a warm bath. After 30 minutes, check the temperature again. If it's still higher temperature, please see the doctor immediately. On the contrary, if low temperature, please add covers. Then 30 minutes later, check it again. If still low temperature, please see a doctor immediately. How to care baby's urine. Observing baby's urine is also important. Please observe urine about 6 times a day. If less urine or crystal urine, it means that infants do not feed enough milk. This is the pink and orange color in crystal urine. To check milk is caused by pyloric stenosis. If always check milk every feeding and decrease the moment about infants, please see the doctor immediately. They will have check milk and spill milk within 3 months. If there is a lot of liquid in the baby's mouth, you can use the suck bowl and flatten it. Then put into baby's mouth and suck out of the liquid. Sucking the nose is the same way. If the vase looks sour and black, please bending hands like C-sharp and putting on the lower chin. Other 3 fingers hold the baby's shoulder and turn to back. And then catch baby on the mother's axillary and keep patting until baby crying. Discharge day. When you are go home, at that day, you need to take baby's clothes to the baby room in the morning. And then baby's check out in the 5th floor. After 10:30, please take your residence permit receipt and you pick up your baby in the baby room. So next, you learn how to take good care of baby. Congratulations.